Good afternoon, everybody. Thank you for coming to today's press conference. We are still waiting on a few speakers, but we're going to go a little out of order, and so I hope you bear with us. And so today I want to welcome you here. We're here about public charge. If you haven't seen it, on September 25th, the New York Times ran an op-ed piece on public charge. It was authored by Dr. Chiu here, one of our speakers, and myself, and it followed a major editorial by New York Times, on public charge and what a threat it's going to mean to the unity of our nation. We are here to talk about the issue of public charge because clearly the release of the new proposal is something that is putting legal immigrants at the crosshairs of the anti-immigrant hysteria and is a new target of the Trump administration. It's a policy that is unfair. It really makes basic services inaccessible to our new legal immigrants in this country. It is dangerous. It is really, anyone reads the 447-page draft, it is so full of bad policy, and it's unimplementable. It's very dangerous for all of us, and it is a proposal that must be blocked. So we have a number of speakers here today that collectively represent millions of people who are going to be organized to block and push back this public charge proposal. So I'm going to start off today and welcome Supervisor Wilma Chan. She has been our champion, both here in the county and as a state leader in the Assembly. She's got her background both in leadership in education, and it has been working with us tirelessly in the months before this proposal so that we will be as prepared as possible. Please welcome Supervisor Wilma Chan.
Good afternoon, everyone. It's an honor to be here with this great coalition that is going to turn back this terrible ruling that has just been published. So I'm really here to do two things. First of all, I want to make it clear that at Alameda County, we totally oppose and decry the proposed rules. This is rules that will radically change for the worse the situation of our legal immigrants in Alameda County, in California, and throughout the United States. I was asked to talk a little bit about my personal experience. Both my parents were immigrants. They passed away, but my mom was from Hong Kong and my dad was from China. They came in the late 1940s. And it was very interesting because they both came on student visas, so they would have fallen in this category. And it was only because the laws changed in 1952 for the first time. The U.S. government got rid of the rule that that you would be allowed to become citizens or not based on national origin. The rules up till that time favored European immigrants and really had a very low quota for immigrants from other countries. So they didn't take aid, but this is part of an overall program by the Trump administration to pick who they think is desirable and who they think is undesirable to come to the United States, which has been a battle that's been going on for years. In this case, they're picking on legal immigrants who've been here, who've contributed, who've paid taxes, who work. They're clearly targeting working class and middle class immigrants of color in this new policy. So my father finally became a citizen in 1952, and I've been bringing this card around because I've been speaking a lot about it. This is the card he got on the day he became a citizen, and he saved it because it was so important to him. And one of the things we're doing today, besides opposing this rule, is encouraging people to apply for their citizenship. But this is a terrible rule. And the reason why is now legal immigrants, before you had to wait 5 years anyway before you applied for these programs. So it wasn't like you could come here and you could just apply for anything. You had to wait 5 years anyway. But now, on top of certain programs that were listed before, the administration is adding very needed programs like Medi-Cal, Medicare Drug Part D, and housing subsidies to the list of benefits that if you take it, you're a legal immigrant, you're trying to change your status to permanent resident, or just to move on in the process and stay longer, you can be deported. And that is really a terrible policy, as I said, that's aimed to keep people from staying in this country. So I just wanted to say that at the county, since the implementation of the ACA, we've enrolled more than 100,000 extra people into Medi-Cal. Many of these people would fall in this legal immigrant category, and now they're going to be fearful about applying for it. Housing is a big issue in this county. We passed A1 bond for low income. And now, if you're in a subsidized housing, you could also be deported if you're in this category. And these things are so needed in Alameda County in California. For the county, we estimate that we could lose $30 million of federal support if these come through. But my second point for being here is to tell the audience and tell people who are listening to this that Alameda County has always provided for everyone, regardless of their immigration status. We have a health pack program. We don't ask people's immigration status. We welcome everybody. And since those programs aren't targeted by this rule, we will continue to do our very, very best. So we want people to know that there is a fallback. We are the safety net. We want you to continue to work with the county if this rule should go forward, but we're going to block it. I'm confident that we're going to block it. We also have state representatives who are going to talk. The state in the past has stepped up when these things have happened. I was at the legislature the last time this happened because the rule was changed in '96, and when I got there in 2000, we made sure that the state picked up some of the cash aid for immigrants that won't be counted in this rule, so we have to work together to do this. So I'm asking all of us to work together. This is the comment period. The county did some pre-comments about a month ago. We're going to continue to work with you. We're going to turn back this horrible policy, and we're going to keep everyone in our community safe. Thank you.
So I'm going to give the briefest of introductions, and these two gentlemen next to me need no introduction. I'm going to start with Assemblymember Rob Bonta. He's Assemblyman for the 16th District. He's been a champion for fairness of all of our communities, but in particular, his legacy with his family in the farm worker struggle, working with the Filipino organizing, makes him just really ready to step up and be our friend and leader in this battle. Please welcome Assemblymember Rob Bonta.
Thank you. Thank you, Sherry, for the kind introduction. Good to see everybody here. I'm Rob Bonta, California State Assembly member. We're in my district right here in Oakland. Honored to be here. I am the chair of the Asian Pacific Islander Legislative Caucus. So all issues of immigration and standing up for and defending and protecting our immigrant communities and immigrant families is absolutely critical to our caucus. You'll hear from my colleague in the caucus as well from across the bay in San Francisco, Assemblymember David Chiu, in a moment. But proud to stand up here with Supervisor Wilma Chan, Sherry, Mr. Chiu, all of our great leaders who are coming here speaking with one voice in support of our immigrants and our immigrant families and against this divisive, damaging, mean-spirited proposal that we're going to push back against with all of our might. And some of you may know my mom is an immigrant from the Philippines. She came here as an adult. She was a lawful permanent resident for decades before getting citizenship just a few years ago. I was born in the Philippines. I came here as a baby. And we know here in California that our immigrants make us better, our immigrants make us stronger, that our immigrant communities are such a critical part of who we are and who we've become as a state and are holders of our future. And I see this as yet another, this mean-spirited proposal on public charge as yet another salvo in the full frontal assault and attack on immigrants across this nation, with a particular impact on California given our size and the population of our immigrant communities, whether it be walls or bans or registries or mass deportations. This is another effort to attack and hurt and harm and assault our immigrant communities. And it's meant to instill fear. It's meant to separate immigrant families from critical fundamental services that many of us believe are human rights, like housing and food and healthcare. And we all know that it's wrong, and I'm honored that we're here pushing back strong early against this proposed rule. The good thing is, here, we are California. Our values are opportunity, equity, justice, and inclusion, that we stand with our immigrants. We have the backs of our immigrants and our immigrant families here in California. And we're one nation, and so we're gonna join forces, we're gonna fight back, and we're gonna protect our families. So honored to be here with this great coalition, pushing in support of our immigrant families. Thank you.
Another person needing no introduction is Assemblyman David Chiu, 17th Assembly District. He has stepped up when no one else would on the nail salon workers, and because of his leadership, we have legislation that protects a whole segment of workers that heretofore were unrepresented and uncared for as they did our nails. So we are so glad that we have this fighter that has in his DNA is his civil rights background and his fierceness as a prosecutor. Please welcome Assemblyman David Chiu.
Thank you and good afternoon. And first of all, as a San Franciscan, thank you for inviting me over the Bay to be part of the warmer East Bay that we're in right now. I'm sorry that we're all here today. It's so important for us to be standing together as Bay Area residents, as human beings who care about our fellow brothers and sisters. What is being proposed is inhumane. It is heartless. It is un-American. The idea that our so-called president would deny medicine to a sick person in front of him, that he would deny food to a hungry person in front of him, that he would kick families out onto the street into snow and rain and the elements to be homeless. It is heartless and it is un-American. This is a move that is forcing immigrant families to make impossible choices. Immigrant families who pay billions of dollars more in taxes than they receive in services. And they're providing billions of dollars for what little we have left of a social safety net. And Donald Trump and his cronies are suggesting that we rip that away. That is not what this country is about. By going after our illegal immigrants, they are showing their true colors. That this is not about so-called illegal immigration. This is about a completely xenophobic, racist, anti-immigrant attack. And this is the latest salvo. And I'm here, along with my great colleague, Mr. Bonta, and others in your state legislature to say, we stand with you. We stand with our community. If they come after any of us, they have to come through all of us. That is what California is about. I wanted to say a few words about housing as a chair of the Assembly Housing Committee. Our state, our cities are experiencing the most intense housing crisis, tenant crisis, eviction crisis, homeless crisis we've ever seen in our state history. And this is a time when Donald Trump and his administration have already proposed cutting billions of dollars from federal housing assistance to our states. The fact of the matter is, whoever you are, everyone deserves a right to have a roof over their heads, to live sheltered from the elements, to deserve a safe and affordable home. And the fact of the matter is, because of this new policy, legal immigrant families will be discouraged from applying for the funding that our immigrant communities are paying for. Wilma Chan referenced that it was not long ago that we had a governor in this state who proposed removing benefits of this sort. And I got my start in engaging with Sacramento when I was an immigrant rights attorney. And I brought, along with a number of other civil rights attorneys, we brought a lawsuit against the governor of the state of California for the policies of Pete Wilson in attempting to deny similar social safety net to our legal immigrant communities, including housing. And we prevailed. And I have no doubt that the good people of our state, the good people of our country understand what this is about. We're here standing for justice. We're here standing for our community. We're here standing for the history of our country. We're here standing for the future successes of our country. And those are our immigrant brothers and sisters. And we are going to fight and fight and fight until this policy goes away. And this is why we ask everyone to please weigh in with the federal government on the dangers of this policy. And we will be fighting until it is gone. Thank you very much.
So I'm going to take an opportunity to segue a little bit into the local impact of such proposals. It wasn't very long ago in the 90s when we had a patient at Asian Health Services who delivered twins on Medi-Cal that she was legally entitled to. And when she returned back to her home country to see her relatives who were ill, when she tried to get back into the U.S. at the port, the San Francisco Port of Entry, the SFO, she was asked and demanded erroneously to pay back $40,000 for her cesarean section or that she would be put back on a plane. Her twins were then left at the airport. She was put back on a plane to China, and she has never been able to return. We've had attorneys. She was legally entitled to those services. The state apologized and said that they were not supposed to ask for that money back, but that is clearly the impact of this proposal. And so I ask you to welcome some of the folks. I would like to introduce one of our patient board members, Femy Visperas. I think she is a fighter, as all of our patient board members, which is a majority of Asian Health Services Board, that will help us weather this and fight back. So please welcome Femy Visperas.
Good afternoon, everyone.
Good afternoon.
My name is Femy Visperas. I will be 79 years old in 2 days. I was born in the Philippines, and I am a proud U.S. citizen. I have been a patient at Asian Health Services for the last 23 years. I immigrated to the U.S. first as a tourist in 1955. My son had been recruited by the U.S. military in the Philippines and served in the U.S. Navy for 24 years. I came to visit him and realized that the only way I can be with him is to stay in the U.S. He was deployed in many places, mostly to Iraq 3 times, leaving his family behind. He even missed the graduation of his 2 children from college, only to serve and protect this nation. As a loving mother and grandmother, I wanted to be with him and his family. As soon as I decided to stay in the U.S., I immediately got a job and started working. In order to stay healthy, to be able to work, to support myself and my family, I enrolled as a patient at the Asian Health Services because of the culturally competent care that they provide. Because of their great care, I was able to remain healthy and to continue work and pay taxes to this nation. Now that I hear about public charge rule change, which would affect vital services like health care for immigrants, I worry about other patients. I remember what it was like as a new immigrant. And then also, I worry about the health of all these patients, and also how this nation would miss out on the great contributions of these immigrants. Like myself, my son who had served in the Navy for 24 years, and my entire family. It is not easy for me to share my story. English is not my native language. I am elderly, I have health issues. It's hard for me to get around. But I am here to tell my story, to support the immigrant patients who are affected with this new rule. I am not at risk anymore because I am a U.S. citizen. I am concerned about their health and many patients at Asian services and other immigrant families who will be impacted by this new rule. This is unfair to them, and it puts our community at health risk. Thank you.
So as you can see, we have leadership on every level, and so watch out. We're going to put this proposal back into the dark ages where it belongs. Next, I want to bring up Dr. Tung Nguyen. I'm sorry, it was a little bit out of order. He has been the chair of the Asian Pacific Islander White House Initiative Commission. He's a professor at UCSF. He is a leader of many of the progressive Filipino organizations that are going to rally us around this country. Please welcome Dr. Tung Nguyen.
Thank you, Sherry. My name is Tung Nguyen. I'm here as a scientist, a physician, and a naturalized citizen. So let me talk to you about why I want to work on this from those three perspectives. As a scientist, we know that based on the National Academy of Sciences report from 2016, that immigrants are a major net benefit to this country. Immigrants, as has been mentioned, work more in the labor force than the native-borns. Therefore, they pay more taxes than the native-born. They pay into the healthcare system through health insurance, but they don't use it as much. And whatever public assistance that the first-generation immigrants require from the government, their second generation pays it back. And then, of course, the third generation, once it's here, contribute even more. So from the science says, from bottom line, if we're just looking at this strictly from bottom line, immigrants are great for America. It's great for our bottom line. As a physician, I'm here because doctors care. Our job is to care for patients. Caring for people is what we do. Public charge is the opposite of caring. It is scaring. It is scarring. And it is barring of our people. That's why we're here. And then finally, I'll speak from the point of view of a naturalized citizen, which is why I'm mostly standing up here talking in front of you. I am a refugee, so I would not have been affected by this directly, but I've considered myself an immigrant. Many of my patients are immigrants. And we are tired. We are tired of being demonized. We are tired of being a part of this attack against us. As the assemblymen have said, this is not one thing. It's just one in a series of things. We've got the Muslim ban. We got DACA delays. We've got family separation at the borders. We've got deportations. And we have denaturalization. Yes, they do denaturalize us. No one's safe. That's why we're here. So I am not interested in complaining. I am interested in activating us to fight back. To quote, or to misquote, Public Enemy, it will take more than a nation of millions to hold us back. All right? We have planned to have a series of portals for you to submit public comments to the Federal Register when the rule is officially published. It has not yet, as far as I know, but very soon. Our goal is to get at least 100,000 or more from all of our coalition members. When the rule goes in the Federal Register, if you're on our list, or if you're not, just go to onenationaapi.com. onenationaapi.com, so that you can also contribute by making comments. You don't have to be an immigrant. You can be an ally. You could be a family member. You could be someone who takes care of people who are immigrants. We need your help. We need all of you. We want them to be so inundated with comments that it will take them months to sort through the comments. Okay? Because they have to answer all of them. And we created this network of, I think, over 25 organizations so that we can do this in a structured way. So you don't have to do much. You just have to go to the website, enter the comments. We even, if you would like, we give you some suggestion about what kind of comments to make, but speak from the heart. Why does this matter to you? And then they will have to respond to it. That will be one strategy that we will take to fight this. But I'll finish by saying this. Again, this is not one thing. This is a series of things. If we're going to fight this one thing, we need to fight the series of things. And so, how do we do that in a democratic country? We do that by going to vote. You and everyone who has been an immigrant, who is now naturalized, anyone who's born here, whose parents were an immigrant, have the right to vote. And the midterms are coming up. And what you're going to do, I hope, is to respond to these series of attacks by voting for people who are not anti-immigrants, who are not racist, who do not have heart and soul. Why do I say that? Imagine looking at a young mother with a baby. And the first thing that comes into your mind, the most important thing that you have to do, is to take away their food and to take away their health insurance. What kind of person does that? It's a person with no heart and no soul. We don't want those kinds of people running our country. I want to say something especially to my immigrant brothers and sisters and their families. They want to intimidate us. They don't know what we've been through. We left our home country, everything we knew. We came to a place where we didn't know anyone. We didn't speak the language, and we made our living. And then we thrived in the face of oppression and racism. We get up and go to work and take care of our family against all of these odds every single damn day. All right? So voting, that's easy. We're going to show them that when the time comes, when they tell me to go back to where I came from, I say, no, thank you. I want to take back this country. Thank you.
Next, I'd like to introduce Dr. Kimberly Chang. She's a family physician at Asian Health Services. She is a recently elected Vice Speaker of the House of our National Association of Community Health Centers. Please welcome Dr. Kim Chang.
Thank you everyone for coming here today and showing that this is a priority for you and for all of your constituents and listeners. My name is Dr. Kimberly Chang. I've been a family physician at Asian Health Services for 16 years. I want to share with you today why I'm here today. I'm here today because I stand with my patients, my neighbors, my community, and my friends. Every day that I see patients, I take care of people who need help, people who are sick, people who want to stay well, and people who are trying to get better. They are people taking care of their families, and they are people contributing to their communities. When they see the doctor, when they come in to see me, or any one of my colleagues here at Asian Health Services, they are just like every single one of you here today, and here listening, or here reading. They just need a little bit of help, care, and compassion. But I have to let you know that caring for patients doesn't just mean taking care of an infection or taking care of a disease. It's also about making sure that people can and will seek care when they need to, when they need help. This rule is dangerous, unfair, risky, and hurtful. This rule is dangerous for my patients' health and for my community's health. The fear people are experiencing is real, and it is risky. It's unfair that because they are poor, they are not a priority here in this country. That is unfair, and it's unjust. I am here today to tell you that when I took an oath to become a doctor, when I swore and I vowed to be a guardian and a steward of my patients' health. With doctors all over the country, from the American Academy of Pediatrics to the American Academy of Family Physicians, I stand with our patients. I am also here today to tell our patients this. We will be here to care for you. We will fight for you. This is a fight we believe we can win. And I am still your doctor. Thank you.
Another reason why we know we can win is the next two speakers. I'd like to bring up to the podium CEO of La Clínica de La Raza, Jane Garcia. We have been through all the struggles from Prop 13 to 187 to every divisive proposal that people wanted to throw at us. And like the public charge, we're not going to let it prevail. Jane and I have been always linked arm in arm, sister to sister. We will be that way in this struggle. Please welcome Jane Garcia.
Thank you, sister. I believe in health for all. And notice that I'm not saying healthcare, I'm saying health. And what we know is that the proposed rules would make the use of essential public programs. We're talking about food for children, for families. We're talking about housing and healthcare. And they're talking about taking that away, of destroying the American dream that our communities seek to reach. This proposed rule is a dramatic departure from the current public charge definition. And we're particularly concerned, of course, about the Medicaid rule that would count against an immigrant when applying for a visa or a green card. We know from experience, and as you heard from my sister Sherry, that this isn't the first round. We've been through so many rounds. We're an easy pick. But they forget how hard we fight, and we're going to remind them once again. But there's already an infliction of widespread fear in our patients, in our families, and our community, and we see the result of that as patients are canceling medical appointments and disenrolling from critical health and human safety net programs. That's the intention, right? Because even when we win this one, there's already some damage that we're going to have to control for. Families will undoubtedly defer or simply leave important and necessary healthcare services unaddressed until they have no choice but to seek care in the emergency rooms, which is the most expensive way that one can receive care. In fact, this will serve to undermine the work that we're doing with the hospitals right now in trying to create a system. It's ironic because what we get from the federal government in healthcare is about population health. Here in the state, we're talking about whole person act, taking care of whole communities. And yet, this threatens to undermine all the work we're doing with our partners to see that patients get the right care at the right place. We've already witnessed a lot of families who are terrified. They are absolutely terrified to access basic and critical health care and other services. We have a support group of some of our immigrant mothers who are talking about keeping their children out of school because they're afraid that they're going to be separated from their kids, like we know has already happened. And I can't tell people, don't be afraid of that. I can't assure them of that because we've seen too many times that, yeah, you know what, that's a possibility and it breaks my heart, but that is a possibility. So the proposed rule will force immigrants to forego public assistance not only for them, but for the children, so much for values, for family values. This would impact the health, well-being, educational attainment, and development of children who are part of mixed immigration status families. So even when a child is a part of a mixed immigration family and has legitimate reasons and authority to access Medi-Cal, this is going to deter them from accessing those programs. I want to give you an example of a female patient that's in our care right now. We'll call her Clara. She left her home in Mexico with her children to escape a violent relationship. She was fighting for her life and that of her children, and not a whole lot of finances. But she's got a job, she's working, she's utilized food stamps to provide for her family the best that she can. And she's really conflicted, even though she knows it's going to affect her family and her children, about whether she should move forward or disenroll from access to the benefits for herself and her children. She's consulting a lawyer right now about whether she needs to disenroll from Medicaid, from food stamps, from housing. So people aren't waiting. They're not waiting until our comments get in. They're making decisions right now to the best of their ability on behalf of their families and their children and themselves. The loss of access to her and her family is going to be regressive in every way, shape, and form. When immigrants are penalized for attempting to meet basic needs, it undermines everyone's community health, regardless of where one is from. We will feel the impact whether you're a citizen or not in the emergency room and the entire delivery system. Did we forget? Diversity is our strength. It's harming families and communities, but it's harming all of us because we don't live in isolation. I want to advise patients that La Clínica and our sister health centers, Asian Health Services, we're going to continue to see everyone regardless of your immigration status. And if we have to go back to free clinic status like we started, then that's what we'll do. But we will not abandon our commitment to provide access to basic health care to everyone, regardless of your immigration status or your ability to pay. We've always served a diverse patient population, and we will continue this broader community because population health is all about everybody included. I keep thinking, and the one phrase that keeps coming back to me, Martin Luther King, of all the forms of inequality, injustice in healthcare is the most shocking and inhumane. Those are not my values, and I know they're not your values, and we're going to fight like hell. Thank you.
Thank you, Jane. And this is last but not least, because it's going to take the work of everybody in this room, all of us across this nation, the 1,000 organizations that have signed on to protest this proposal under the Coalition Protecting Immigrant Families. The way that we do this is linking up with our partners that have taught many of us what justice and workers' rights mean in this country. So I'd like to bring up Tina Depp, Executive Board Member of SEIU. She knows firsthand from our patients what they experience. She was the one who case managed a lot of the issues, the case of the mother with twins. And she will talk to you today about how we're going to win this fight. Tina.
Good afternoon. My name is Tina Depp. I'm here at Asian Health Services, and I was also community health advocate as a member of SEIU 1021. I'm here on behalf of 60,000 workers represented by SEIU 1021, of whom provide public services, and we are the nurse public hospital and the social workers in the community and cities, and the provider of nonprofit like Asian Health Services and like La Clínica. The newly proposed public charge rule is yet another cynical attempt by Trump administration to divide us and to underline and undermine a funding that goes into public programs that as well we rely on. These are the programs that we keep all our communities healthy, safety, limited access to health, housing and nutrition program for immigrants and working family effective of us. SEIU here in California across the country and stand strong in our union and stand up and fight back. We are making our voice is heard at the ballots, and we will do everything in our power to protect the safety, dignity, civil rights of those who rely on us of their cares. Please vote. Thank you.
So we're going to tie up the presentations and open for Q&A. I wanted to mention that the op-ed piece that I talked about at the beginning has already received over 500 comments, and the vast majority of people are uniting around how horrible of a proposal this is. And I just want to say, one of them said, they came for illegal immigrants, and I am not one. They came for legal immigrants, but I am not one. Then they came for X, Y, and Z, and I wasn't one of them. And then they came for me. So I'd like to open up for questions. Do you have any comments? Do you want to say anything? It is a very complex proposal. It's 447. We have all the information and links in your packet. We have a list of the 1,000 organizations across the country that are saying no to this, including the AMA and the Association of Pediatricians. This is not something, we have farm owners who own farms who are very opposed to this proposal. So we are going to work to unite all of that effort and to block this proposal. Thank you.